Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're actually looking from the front already, from the front towards the back. And the reason is when we examined your shoulder, once we had you under anesthesia, your shoulder was pretty unstable towards the front. Now, as I look in here, I'm seeing a lot of damage towards the back, at least in the labrum, and that's what we're smoothing out right now. But your shoulder was dislocatable anteriorly. And so we're going to work on this. We're going to certainly not leave you like that. And then the other thing that was really interesting is that your biceps tendon is already absent from inside the joint. And we'll show you in just a second what I mean. But this is the posterior labrum. You can see how it's got a little split there and signs of ongoing damage there. And our plan is to place a suture anchor down right about here and make some sutures in the posterior capsule, and then also to tighten up this anterior band of the inferior glenohumeral ligament to prevent that instability from happening. I don't see a classic Bankart type of injury, but your labrum is a little bit small. Take that in the front. So there's our view down the front of your shoulder here. And I think just tightening up the anterior capsule with an anchor right about here will be a smart thing to do based on your exam. So your biceps tendon, let me show you what that looks like, or what it doesn't look like here. Okay, so as we look towards the front of your shoulder, your biceps tendon normally runs right around in this region here. And it's not there, it's absent. So it either tore or it was never here. I think more likely is it tore based on what we know. But the biceps tendon is already completely absent from the joint. Your rotator cuff looks great. So we'll get to work and show you some more in a little bit. Okay, so we're getting ready to start to plicate the capsule. And this hook that you see coming in is a suture hook. It's loaded with a black wire called a super shuttle. You can see it there. Put the grasper in the front. So we're going to start here. We're going to rotate, and we're going to go into the capsule right about here. And then once we make sure that we've gotten through once, we'll get that through and show you in just a second here. So here we are, peeking underneath there. You can see the tip of the relay. Just a minute, you'll see the tip of the relay. Hold the camera there with the other hand. There it is right there. And now the trick here is to retrieve it. Hold the suture hook. We'll retrieve that right here. And then outside your shoulder, we're going to load that black wire with that suture that's going through the same cannula. You can't quite see it. Okay, so there's our first stitch. Hold right there. We're going to tie this as an interrupted stitch, which means that's going to be our post. That's this. Okay, good. We've already rasped the capsule, by the way, which just makes it a little sticky so it'll heal well. You can think of that as trying to make it like a piece of Velcro so it just sticks together once we put these sutures in. So we're just tying some half hitches here to secure this knot. You can already see how this has tightened up this part of the shoulder. This is the last one here. Okay, so there's the first one. Okay, and now we're going to place one more just to the right, which is a little bit superior. Shaver, did you turn to the left to me? Okay, so there's our next anchor in. You can see how it looks there. We're going to take our suture hook, hold the camera here. We're going to rehearse our stitch. We'd like to end up there, which means going into the capsule right about here. And then as best we can, we're going to come underneath that labrum like that. Thank you. And then we'll reach in the front and retrieve it like we showed you before, just like that. So we'll go off on the video, show you some more in a minute. Go ahead. Hold on. Okay, so I like the way those two look. That's really holding down that labrum. We may have to place another one because as you can see, there's still some laxity that I can appreciate here. Even though you don't have a biceps pulling on it, there's still some labral laxity here. And I don't know that I'm fully comfortable just leaving. I'm trying to rotate the scope so I can see it better. That looks pretty. Just hold just like that. Okay, hold just like that. So we'll see if we can... If we're going to put one in, I'd want to put it in right about here. Okay, so here's that third and final posterior anchor and suture. It's the black and white one. We didn't get as much capsule with that, but now as we look down the back of your shoulder, we can see that things are a lot tighter. I'm hoping that provides some posterior stability. And now we're going to look down the front. I'm going to push this cannula in a little bit. And now we're going to have a look down the front. My thought is that we're going to have to place a suture anchor in right here. See where the labrum is starting to peel away? And this is where the instability was. So we're going to place one anchor in, kind of in a mirrored position to that one. We're going to place it right about here. Okay. Okay, so here's the anchor in the front. And here's our suture hook. We'll show you once we have this stitch done. Okay, we've placed a mattress stitch in the front to tighten up that anterior glenohumeral ligament. You can see that looks great. You can have a good look at the bumper even there. And I think the humeral head is pretty nicely centered. We had to repair this labrum in the back. And I think we're going to finish up here and get you back to the recovery room shortly, okay? Once again, that biceps tendon was just absent. It normally comes off just to the right of that blue cannula. And no signs of any trauma except the rest of the labrum, but where the biceps normally comes off, it's just missing. And there we can see the middle glenohumeral ligament coming down. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.